we're on the ground in Washington helping Fight SMA to make the case for to boost funding for SMA research in the federal sphere. And I think it's very exciting to consider how much of an impact a young person facing the challenge of living with SMA can make in Washington or back home. And I think that's an important thing to talk about. You know, beginning, I think the first step is just writing a letter or an email to your member of Congress or senator describing the challenges that you've faced and the importance of federal research funding for many researchers around the table. I know will say the same. It's not the only source of funding, but it's a big source of funding, and it's a seed to oftentimes private sector funding. And so it's important to educate members on the Hill about SMA and about the importance of federal research. We've had an experience over the past 10 years where I think when we first started going into offices, many of the staff we met with had never heard of SMA. And so there was a big push to just establish that baseline of knowledge. And I think, you know, patients who want to be advocates can really have an impact, even at home. We can provide background on who your member of Congress is, just from your address, what interests them in terms of their committee memberships, things they've been active on in the health front. And I think the letter is kind of just the first step, really. You in that letter, you could ask for a meeting in the district or state near your home. And this is, I think, probably the most effective way to bring about change. It's all about timing, and also traveling in groups is important. I think you know, the best way to see a member is to bring in your colleagues, your friends, your fellow advocates, and ask for a group meeting with your organization during a congressional recess back home in the district office or the state office if it's a senator, because that's when they're there and they have time on their hands. And when they're in Washington, it's very difficult to see them. And it also, of course, can be challenging to travel to Washington. That's where the policy staff reside, who are close to the legislative action and know a little bit more maybe on the policy front what's going on in the agency. So if you can do it, that's fantastic. But you can really have a big impact even from back home. And it's so important because Congress authorizes all of these agencies, the National Institute of Child and Health and Human Development, the National Institute of Neurological Disorders and Stroke. These are all authorized and funded by Congress, and the appropriators, especially the House and Senate Appropriations Committee, every year determine what number is going to be pegged to one of those agencies. And they also, from time to time, and we've worked on this in the past, will include report language urging the agencies to do more on SMA, for example. And so I think advocates can really help us to make that happen more and more.
As most people here know, for several years we would meet in Washington and bring our children and go visit our representatives on the Hill. We've done both. My daughter has met with our congressman's representatives in Illinois, and I will admit I was intimidated by the process at first.
Mm-hmm. You were intimidated?
I was very intimidated. My daughter was not. But it is really a fascinating process. And you do feel like if you're going to be spreading awareness of SMA, that is a really good way to do it.
It's important, first and foremost, to make sure members are aware that SMA is the #1 genetic killer of children under 2. Beyond that, I think making the case that there's a lot of fundraising and advocacy going on out there in the hinterland that Washington folks may not know about. What they don't respond to well is coming and asking for the federal government to step up first. I think the most effective advocacy is to go in and say, look, we're already putting $15 or $20 million a year, whatever it may be, into SMA research on the private front. And that is seen, I think, by the appropriators and by the agencies themselves as a real incentive for them to match those dollars that are already out there. So we've done a lot of that, and I think with some success.
We like to say what happens in SMA can often impact other disorders. And one of the things, actually, I talked about our group this just today at the meeting was how we actually looked at 100 different disorders using the SM2 inducing model. And in point of fact, we've identified therapies using the same rather simple-minded concept of turning genes up for a handful of them. And so there really has been a rising tide, all boats. I mean, that's not the first point you're going to hit with the SMA sort of effort, but it's certainly, I think, worth mentioning that really the research in SMA has spilled over to other disorders.